Hi, I'm Paula Caplan, and what I'm going to be doing is presenting a paper that I wrote that was initially published in madinamerica.com on July 10th of this year, and it's called "Is COVID-19 Making Everybody Crazy?" The coronavirus pandemic has provided a golden opportunity for some psychotherapists, big pharma-funded entities, and others who've sounded an alarm, claiming that massive numbers of people are mentally ill, and that's in quotation marks, because they have fears about the virus and reactions to social distancing. Media producers promoted these warnings in a big way in May, which was Mental Health Awareness Month. And a Washington Post article around that time had this headline: "A third of Americans now show signs of clinical anxiety or depression," Census Bureau finds amid coronavirus pandemic. So they made that claim. And then there was a New York Times article by Andrew Solomon, a psychologist, and he reported data that nearly half of respondents in some study said that the pandemic harmed their mental health. Mental health. Shockingly, he equated harming mental health with mental illness becoming what he called universal reality. Now, if being at all upset and therefore having your mental health harmed is the equivalent of mental illness, then that's a big problem. In a June 5th press release, the American Psychiatric Association, which you may or may not know is a lobby group, it's officially a lobby group for psychiatrists, they reported an increase in psychiatric disorders during the pandemic, and it based this on an anonymous online screening tool. Now, screening tools that allegedly tell people taking the test whether or not they have a mental illness, including the Mental Health America tool that they used, they're usually based on a list of feelings and difficulties that most people feel sometimes. And the cutoff points they give for when you should seek professional help are just not scientifically based. Their screening tool includes the instruction to take their depression test if you're feeling overwhelming sadness. Do we really want to call overwhelming sadness in response to this situation, the isolation, the fear, the unknown future occasioned by the pandemic, a mental illness? And they say to take their anxiety test if worry and fear are affecting your daily functioning. Well, who these days doesn't worry whether their mask is adequate, whether they've washed their hands enough times and in hot enough water, whether to stay away from a beloved elderly relative for fear of communicating the virus and thus increase their loneliness, or go see them wearing masks and gloves and staying 6 feet apart, but still worrying because we might find out later that 6 feet of distance wasn't enough. So of course people are feeling anxiety. Want to call that a mental illness. Such claims promise a vast expansion of the market for therapists, but such claims carry great potential for harm, adding to the burdens of people with upsetting but understandable, deeply human feelings by informing them that they have psychiatric disorders. Anyone having upsetting feelings deserves love, help, understanding, and support, whether from family and friends, or if they choose, from clergy or therapists. But people also deserve to know about the dangers of classifying all upset as mental illness. There are two common meanings of the term black box, and both of them apply here. One meaning comes from the Food and Drug Administration's black box warnings to alert potential consumers to a product's dangers. And as applied in this case, people should be warned not to rush to call their upset mental illness. When people are struggling, suffering, or responding in unusual ways, they frequently fear that their feelings mean they are mentally ill and that they should be doing better than they are. One of the most helpful things that therapists and friends can do is to let them know that their feelings are deeply human reactions, not signs of illness. I want to take a look at 4 facts that make it clear that caution is warranted before pathologizing reactions to the current pandemic. Here are the 4. First of all, little is still known about COVID-19 or how to protect oneself from it, and its effects can be fatal. So, or at least long-term, very long-term, maybe for years. So feeling confused, frightened, even terrified, powerless, and helpless should not be classified as psychiatric disorders, but rather as normal and understandable reactions to extremely unusual events. Point 2, as poet Heather McHugh observes, in our daily lives under ordinary circumstances, we tend to avoid what she calls our fundamental terror at our own deaths. But the pandemic's massive concentration of so many deaths at once, and the fact that our own death is now more likely to be imminent, she says, makes the burden of the knowledge of mortality weigh heavily on us. She cites a poem by Audre Lorde called A Litany for Survival, and it ends with the very powerful line, "We were never meant to survive." Suddenly to be confronted with something so terrifying for many people that they usually drive it out of awareness is a shock. And this is disorienting in its own way. Fleeing from thoughts of death doesn't work as well now. So how to begin finding other ways to cope with our mortality? Point number 3, physical isolation from others interrupts the participation in community that is proven to be healing. And social distancing and stay-at-home policies drastically reduce participation in community. Connections on Zoom calls have skyrocketed, of course, and they can be helpful, but they have drawbacks. Many of them include numerous participants, so that can inhibit deep conversations about feelings, and it can inhibit creation and maintaining of meaningful relationships. And then on Zoom calls, there's some strain involved in monitoring who is speaking and when to jump in, and it requires extra energy to remember to stay within camera range, monitor when to mute and unmute oneself, and project enough to be heard. No Zoom call can replace human touch, which promotes security, happiness, and belonging. Being unable to hug a loved one without fear of unknowingly transmitting or getting the virus seriously interferes when we want to see people with whom we don't live. Grandparents, elderly parents, grandchildren, friends, neighbors. Point 4, many people are grappling with increased loneliness, with alarm about losing jobs and work identity, new financial crises, and child or spousal abuse. Asians and Asian Americans have been targets of discrimination and abuse because of claims that COVID originated in China. Many African Americans and Latinx people and people in nursing homes, prisons, and psychiatric hospitals know that their risk of getting the virus is higher than that of others. And that compounds fear, suffering, and anger about the reasons for the increased risk. Upset due to any of these causes should not be called mental illness. The same applies to frontline healthcare and other essential workers and people who have suddenly had to provide constant care for family of all ages and education for offspring, or for those grieving loved ones' deaths. As with military veterans who are traumatized by war, or victims of all forms of oppression and violence, the last thing such people need is to be told that their reactions are proof that they're psychiatrically disordered, that the message is that they should somehow be coping better, and that only adds to their burden. No wonder so many people are feeling upset. People who are suffering emotionally from the effects of COVID-19 deserve help, of course, but it must be real help, such as lifting their economic burdens, protecting them from violence, and increasing community support, not to mention health insurance, but including all of us showing that we're willing to listen to what they're going through and acknowledging how common these struggles are. Importantly, we must let them know that their suffering doesn't warrant classifying them as mentally ill. And the special UN rapporteur, psychiatrist Danius Puras, has said that as well. An increasingly pervasive pattern is leaping to recommend therapy, and I put that in quotes because it can mean just about anything, or mental health services when attention is drawn to human suffering. Now, this relates to the older meaning of the term black box, which is something whose inputs and outputs can be viewed, but whose internal workings are unknown. So the terms therapy and mental health services are black boxes. They're so vague, they can include the entire range of good and bad therapists and good and bad approaches. Often, well-meaning friends and family, and certainly legislators, feel they've done their bit by sending someone to therapy or voting to increase funding for such services without ensuring that the therapists are caring and effective, or that the services are ones that actually help. Some therapists, of course, are terrific, and some approaches classified as mental health services do help some people, but some therapists and some approaches cause harm. Psychiatric drugs sometimes help, as we see in Robert Whitaker's classic book, Anatomy of an Epidemic, but they very often cause harm. And the use of psych drugs has skyrocketed early in the pandemic, perhaps due to people assuming they would need them. But then after a while, it declined to around pre-pandemic levels. Other approaches can cause harm, and some services actually increase suicides. Furthermore, as soon as a person is diagnosed as mentally ill, their own focus and that of professionals and often well-meaning loved ones tend to veer sharply away from non-pathologizing, low-risk and no-risk approaches that are known to be effective. So they'll go, okay, so therapy or drugs, or both, what's it going to be? And they don't think about other things, more than 24 of the latter, such as involvement in the arts, physical exercise, meditation, having a service animal or just a pet, doing volunteer work, and having a listener can be seen at a website that you can find that if you Google A Better Welcome Home, which was the name of a conference that this comes from, and the website comes from that, and at the same time Google YouTube and Harvard Kennedy School. And there you will see the presentation of more than 24 of these approaches that are very helpful to just about anybody. And the conference that they came from was about veterans and their families, but really these approaches can be helpful to anyone. But entities like the APA, in fact both APAs, the American Psychological Association as well, don't tend to mention such approaches, but they only focus on therapy and drugs. And the MHA screening tool that I referred to earlier urges people to see a mental health professional. That's it. Lauren Tenney, who is a Ph.D. psychologist with expertise in trauma and human rights violations, says, and this is a quote, "Emotional responses people are having to the unnatural and traumatic circumstances created by the pandemic are not signs of supposed mental illness." She stresses that people who are experiencing a range of emotions outside their comfort zone ought to see these emotional upheavals as par for the course, given what's happening. And they should, she said, they should attempt to embrace the depths of feelings that social isolation can create. What she urges those who are suffering to do is, she says, actively work to connect with others who are having similar experiences. And she suggests people should be supported in finding resiliency in the face of environmental adversities. Even Google is getting into the pathologizing act. They've partnered with the National Alliance on Mental Illness, NAMI, to post an anxiety self-assessment tool. The announcement of the partnership included the description of NAMI, which is heavily funded by Big Pharma, as a grassroots organization. And they use a tool that's based directly on a psychiatrist's description of anxiety and is titled with a psychiatric disorder's name. Furthermore, they say they will provide access for resources. There's that black box, another black box word, resources, is so vague. They're going to provide access to resources developed by NAMI. A major source of confusion is that when the terms mental health problems or mental health conditions are used, instead of, for instance, emotional upset or suffering, they are very often taken immediately to mean mental illness. So as a result, media reports of increases in which understandable reactions to the pandemic are described as mental health problems are easily assumed to indicate increases in psychiatric disorders. And of course, as I've said elsewhere many times, there's nothing scientific about what get called psychiatric disorders. Compounding the confusion is that psychiatric disorders are widely but wrongly assumed to be scientifically validated entities. So in the face of claims that there have been increases in mental illness, rarely does anyone ask the basic question, which is, but isn't mental illness defined unscientifically and by whoever has the power to define it? Instead, the assumption is made that it's clear what mental illnesses are and that they are rising. One example is a recent warning that the pandemic will increase postpartum depression and perinatal mood and anxiety disorders. The author, a psychiatrist, comes nowhere near to questioning the validity of these categories and simply alleges that they are partly neurobiologically caused. And she pathologizes expectant mothers' totally reasonable fears that the pandemic provokes in a variety of ways. She pathologizes them despite the fact that she acknowledges that social supports, which are harder to get in the coronavirus era, are crucial to preventing what would more properly be called postpartum isolation, fearfulness, and sadness rather than psychiatric disorders. Curiously, the World Health Organization's Director General warns that, and this is a quote, the pandemic is highlighting the need to urgently increase investment in services for mental health or risk a massive increase in mental health conditions in the coming months. Now, he says that despite noting that pandemic factors like, this is a quote from him, social isolation, fear of contagion, and loss of family members are compounded by the distress caused by loss of income and often employment. The psychiatrizing of America and the world has been so efficacious that many professionals and lay people readily assume the traditional mental health system can and should solve all emotional problems. Evidence of the limitations of that system include high and increasing rates of suicide and death, and high and increasing rates of long-term disability of people treated in that system, which isn't to say that there's nobody good in that system. Good therapists and lay people can help normalize feelings and explore useful ways to cope. But therapy must not be seen as the only option or as the one that will definitely help. What's been proven helpful to suffering people has included freedom from economic pressures, freedom from poverty, violence, oppression, and from inadequate physical health care. What's also been proven to help is a safe place to live and meaningful human connections. Even the authors of a recent British Medical Journal article that warned of a tsunami of mental health cases note that people most at risk are those with what they call precarious livelihoods and poorest health. And fortunately, some groups are assuring people that their upset is understandable in light of the strange, new, massively and abruptly changed circumstances and being torn from their usual communities and sources of support. Now, controlled studies of approaches that are aimed to reduce emotional suffering are nearly impossible to create. But there's an interesting contrast of the effects of a traditional pathologizing approach and those of non-pathologizing ones, reported in a recent article about two neighboring Ohio regions. Although more information is needed from similar contrasts, the report from these two is of interest. The Richland County Mental Health Board, which has encouraged the traditional use of counseling and crisis hotlines, reports a recent increase in suicides. Nearby, Ashland Mental Health and Recovery Board Executive Director Steve Stone, whose board advocates non-pathologizing approaches, or what he calls self-care and natural support systems, they report that their crisis services have not increased and in some respects have slightly decreased, and there have been no suicides and no increase in new people seeking help. Steve Stone cited peer support programs that they have as crucial to keeping their numbers low, their numbers of serious problems. And that includes a sewing group in which community members made hundreds of face masks, and a writing group that will write letters to patients in state hospitals during the pandemic. Stone is quoted as saying that they rely very little on state hospital and inpatient programs, and he, quote, thinks the need for professional mental health services will remain low based on common sense approaches of people taking care of themselves as well as each other. It will add to the tragedies caused by the current pandemic if all hope is focused on the mental health system and is diverted from the many things that reduce suffering and that do so without calling all suffering mental illness.